For our numbers today, we have confirmed 81 new cases of COVID-19 in the last 24 hours. This brings the total number of cases to 1,732. Of these, 877 people have recovered. This is 54 more than yesterday. We suspect 254 of our total cases may be as a result of community transmission. Sadly, I must report an additional 2 deaths from COVID-19. One of these deaths occurred in the Care West SARC Continuing Care Facility in Calgary Zone. I want to offer my condolences to the family and friends of these individuals. This is a difficult time. The loss of these lives is a reminder of why we are taking the measures that are implemented now. Preventing the spread prevents deaths. Another way of preventing the spread is through testing and putting measures in place for confirmed cases and contacts. In the weeks since the first case in Alberta, our provincial lab has done a remarkable job of increasing its capacity for testing to meet the demand. Our labs completed 2,465 tests in the last 24 hours, bringing our total to 77,007 people tested since our response began. We have seen from other jurisdictions that have successfully flattened the curve that aggressive testing is essential to controlling the spread. As I've said before, it's extremely important to not just complete as many tests as we can, but that we are also purposeful in our testing. In the past few weeks, we have adjusted eligibility requirements to ensure those most in need or at highest risk are able to access testing. Starting about 10 days ago, when our lab was able to clear the backlog of samples from returning travelers and was also able to expand their ability to run more daily tests, we started testing healthcare workers. In addition to anyone with respiratory symptoms admitted to hospital, anyone ill in continuing care settings, and samples taken in our primary care influenza surveillance sites. Shortly after that, we added first responders and correctional facility staff. Most recently, we expanded eligibility for testing to anyone with COVID-19 symptoms in the Calgary zone and anyone 65 years or older or who lived with someone 65 years or older across the province. Even with all these expansions, we still have capacity to do more testing, and so at this point, we are expanding further. You have previously heard me say that we were not able to test every Albertan with a cough or runny nose, but we believe that we may now be at the point where we can do so. That is why, effective immediately, we are expanding eligibility for testing to anyone in Alberta who has a fever, cough, shortness of breath, runny nose, or sore throat. With this change, going forward, we will see a further increase in the number of cases confirmed every day as a result of this testing. We have already seen this increase over the past few days with the expansion that we have already done. I know seeing this increase in numbers may be a concern to some, but it's important to remember that the number of daily confirmed cases as a percent of the tests done every day has remained approximately similar through the past several weeks. When we look at the provincial numbers by the date the swabs were collected, the percentage of tests that have come back positive has been approximately 2% for the past several weeks. This indicates that the rate of infection has remained relatively stable over the last while. Our current testing capacity is approximately 7,400 lab tests that can be run in a day. We are aiming to have that up to about 9,000 tests a day by the end of the month. And ultimately, our testing goal by mid to late May would be approximately 20,000 tests a day. That would be a combination of swab tests as well as serology, the blood tests. And so I think there's a really good chance that we will be able to hit those targets. But there's always that need for that note of caution because a lot of that work does depend on supply chain, depends on shipments arriving, and so we continue to assess day by day, but at the moment, again, we do have the capacity to expand our testing as of today. Albertans and Canadians need to be prepared that the pandemic will continue to have an impact on our lives for many months to come. That impact will shift and change over time. However, we will need to continue to be vigilant for anyone who's feeling sick to be staying home and away from others. Some of the enhanced measures that we've been talking about are expanded testing, our ability to do contact tracing in a really robust way, making sure that if someone is a close contact of a case, that they do stay home for 14 days. In addition to travel restrictions, thinking about where Albertans travel to and where they come back from and whether or not they need to go into that 2-week quarantine after coming back. All of those are things that I would anticipate will be in place for some time. We know that many of the events that we would call super spreader events, which is where you have maybe one infected person and out of a gathering you end up with 20 or 30 infected people from one event. We know that many of those events were more social gatherings than anything else. And so I think something like the Fringe Festival, other social gatherings, until we have a vaccine or some other means of ensuring widespread immunity, some of these gatherings are going to be the riskiest kinds of activities to engage in, especially gatherings that bring together people from all over the country or all over the world. So those kinds of restrictions I would anticipate will be in place for some time. However, restrictions about other activities, workplaces, again, those are the kinds of things we're looking at. How can we ease off on some of those things at the appropriate time so that we can have a little more of a normal return to our day-to-day, while some of the other pieces will probably be with us for a lot longer.